Today, you now have a choice. If you suffer from severe neck or back pain, you want to talk to your spinal team. Your spinal team helps patients suffering from severe pain to regain motion and get on with their normal daily lives. Spinal fusion used to be the only remedy. The problem with a fusion, a procedure that biologically welds two bones together, is severe stiffness will occur after the procedure, and the adjacent joints will have to perform extra work and will go on to early deterioration. The pain and discomfort could return. Now you have a choice. Remove the damaged spinal disc and replace it with a state-of-the-art prosthesis, similar to the current knee and hip replacement procedures. It's called Pro-Disc Total Artificial Disc Replacement, and your spinal team has performed more Pro-Disc Total Disc Replacement surgeries than any other team in the USA. Total disc replacement eliminates pain, restores movement, and allows people to resume a normal lifestyle. By helping patients regain motion, your spinal team makes it possible for people with spinal conditions to get on with their daily lives.
Hello, I'm Dr. William Capicato, and I'd like to introduce you to your spinal team. As a team, we perform a number of different spinal surgeries. However, the focus of your spinal team is artificial disc replacement. Our website is very accessible and easy to use. We go through the reasons for disc replacement versus spinal fusion, and why we think that for many patients, disc replacement is a better solution. Our concept of using a team approach in which we have an access surgeon present for the entire operation with the spinal surgeon, in our opinion, leads to better results for our patients. Now I'd like to introduce you to my associate, Dr. Michael Pell. Dr. Pell has great experience in access surgery for the lumbar spine. He helps me not only in my lumbar cases, but also in a number of cervical spine cases. He and his partner, Dr. Rasmussen, have compiled about 4,000 cases of access surgeries to the spine over the past 10 years. And he has quite a wealth of knowledge, and as I stated, is a skillful surgeon.
Hi, Bill.
All right. Thanks for coming.
You're welcome. Over the last several years, my partner and I have developed several innovative techniques that really help provide the spine surgeon access.
Now I'd like to introduce Dr. Joseph Muscarella. Dr. Muscarella is an ear, nose, and throat physician, has great experience in head and neck surgery. Joe and I have known each other for a number of years, and we started performing surgeries together a number of years ago, and he's always been a trusted companion. Like Dr. Pell and Dr. Rasmussen doing our abdominal approaches, Dr. Muscarella helps and performs access for our cervical spines. The classic solution for many patients that have painful disc injuries or disc disease in their cervical spine or lumbar spine would be that of a spinal fusion. And the spinal fusion is a good procedure, however it does have some drawbacks. The first drawback is that most patients have stiffness after a spinal fusion, and this can be quite unacceptable for patients. Other issues are that of incomplete pain relief, and a third issue that becomes problematic on a long-term basis after spinal fusion is that phenomenon called adjacent segment degeneration or adjacent segment deterioration, in which the discs next to the fusion deteriorate and become painful, leading to another fusion. As an alternative, total disc replacement allows for the patient to start immediate motion after surgery. There's no bracing involved. The operating times are less, the blood loss is less, and patients are able to return to higher levels of activity after a disc replacement. When a patient is having a fusion done from the front of their spine, the fusion device, or the fusion cage, or the block of bone that's being used to fuse or weld two vertebrae together could be positioned perhaps a little to the right of the midline or the left of the midline or a little anterior or posterior to the center of gravity. Now that's far different than putting in a prosthesis that has the capability of restoring motion.
The neck has to move in a lot of different directions, and fusion of the neck, although again, I'm not a spine surgeon, I'm just the access surgeon, it always seemed like it was a compromise somehow. And now I'm really excited that we may be restoring some sort of mobility. And restoring this mobility also keeps things aligned the way they're supposed to be in the neck, and the esophagus and other structures that are there, I think, are able to function more normally. I'm quite excited that we're moving ahead with this type of a procedure rather than the old fusion.
It's commonly known that when you fuse two levels of the spine, the next level will take the brunt of the motion and will blow out.
So what we're achieving is similar to what the hip and knee surgeons have done at restoring function and more normalcy to the spine. And those patients have less fatigue, less pain, and go back to higher levels of activity. If you have a fused neck and you're driving down the street and you want to turn to look or turn to back your car up, it's difficult. Those patients will tell you that they're very fatigued. And the same thing with patients that have a spinal fusion. They will tell you that at the end of the day, they're very fatigued because they do not have the normal mobility of their pelvis as they walk and bend and push and pull and turn throughout the day.